Symptoms of benign prostatic hyperplasia or BPH can be uncomfortable and distressing for someone with a prostate. This may negatively affect their dating game, but it doesn't have to. In this video, I'm going to cover the causes and symptoms of BPH, current treatments, and tips to keep symptoms at bay when you're on a date or having sex. Men with BPH may not experience any symptoms at all, but men who have symptoms may experience urinary hesitancy, straining or pushing to urinate, weak urine stream, discomfort with urination, urinary urgency and frequency, urinary tract infections, waking up to use the bathroom more than twice, urinary incontinence, post-void dribbling, reduced urinary flow, and feelings of not fully emptying the bladder. BPH can affect sex and intimacy too. Although not a direct cause, certain medications and surgical treatments for BPH may contribute to erectile difficulty and ejaculatory control issues like retrograde ejaculation and discomfort with ejaculation. Physical changes in the prostate may also be a reason, but there has been no clear correlation between the size of the prostate gland and symptom severity. Lower urinary tract symptoms are more common as men age, with 1 in every 6 men experiencing urinary incontinence. Results from a National Health Survey from 2010 showed that out of 3,083 men who were asked about prostate enlargement, 687 of those men reported being told they had an enlarged prostate gland and reported moderate to severe urinary incontinence symptoms. BPH causing urinary incontinence has tremendous impacts on a person's quality of life. Some of those include depression, avoiding activities they once loved like dating, sex, and exercise. When dating, they might need to excuse themselves frequently to use the bathroom, which could disrupt the flow of conversation, making them feel self-conscious and worried that their date will ask questions or make assumptions regarding their behavior. Men may shy away from sex altogether if they're worried about peeing during sex, urinary tract infections, and potential erectile failure or ejaculatory issues. So what is BPH and what causes it? The term benign prostatic hyperplasia or BPH is often misunderstood. BPH occurs when glandular tissue, smooth muscle cells, and connective tissue change within the transition zone of the prostate, which is located around the prostatic urethra. BPH describes the biological tissue changes that occur which may or may not lead to prostate enlargement or lower urinary tract symptoms. Not all men with BPH will develop prostate enlargement or lower urinary tract symptoms. The exact causes of BPH is unknown, but it has been considered to be a complex symphony of biological and environmental influences. For example, aging and hormonal changes, upregulated local or systemic immune responses, insulin resistance, diminished circulation to the bladder and prostate, obesity, race. For example, African Americans have a greater propensity for BPH, excessive alcohol consumption, and physical inactivity. So what are the treatment options for BPH? There are pharmacological, surgical, and non-pharmacological ways men can manage symptomatic BPH. Pharmacological treatments include medications such as terazosin, tamsulosin, and finasteride. A word of awareness, fellas. Terazosin and finasteride can contribute to low desire, difficulty with erections, ejaculation problems, and pain with ejaculation. Tamsulosin, commonly known as Flomax, has also been shown to cause retrograde ejaculation because it relaxes the smooth muscles in the prostate and bladder neck. Surgical options may include transurethral resection of the prostate, known as a TURP procedure, urolift procedure, prostate laser surgery like the green light laser. Non-pharmacological treatments include self-catheterization, especially if there's urinary retention, being mindful of medications that influence the bladder and continence control mechanisms like antihistamines, diuretics, and certain pain medications, just to name a few. Bladder and pelvic floor muscle training, monitoring for insulin resistance, and prioritizing lifestyle habits like exercise, sleep, nutrition, and stress reduction. So if you're someone with symptomatic BPH on a date thinking of staying the night with someone, Here are some strategies you can use to manage those bothersome urinary symptoms. Be mindful of bladder irritants such as alcohol and caffeine that may exacerbate urinary urgency, frequency, and incontinence. Resist the urge to avoid drinking any water the day of your date. Not drinking enough water can make your bladder crabby, so sip water throughout the day. If you experience urinary retention, overflow incontinence, or incomplete bladder emptying, consider self-catheterizing right before your date to fully empty your bladder. If you're worried about potential urinary accidents, consider wearing an absorbency garment. You may also consider bringing an extra pair of underwear or catheterization kit. Consider medications that can help reduce urinary symptoms of BPH like alfuzosin, silodosin, terazosin, tamsulosin, and finasteride. Communicate your needs with your date. This can help you avoid any embarrassing situations and make your date more understanding of your condition and your needs. Practice deep breathing exercises to help relax the bladder muscle and reduce urinary sphincter muscle tension. This can help manage urinary urgency and make urination easier. The calmer you are, the calmer your bladder will be. Practice urinary urge suppression techniques, including coordinated pelvic floor muscle contractions to calm the bladder muscle down and reduce urinary urgency. Maybe it's time to connect with your favorite pelvic floor therapist. One more thing, if you're worried about peeing during sex, consider these additional tips. Wear a condom, it's also a safe sex practice. Use a constriction ring, which can help with penile rigidity and prevent peeing during sex. Limit fluid intake 1 to 2 hours before sex. Empty your bladder right before sex. Explore sex in the bathtub or shower to buffer the experience of other bodily fluids like urine. Try sexual positions that reduce direct pressure on the bladder, like on the side or on top. Use sheets or mattress guards like waterproof mattress protectors, rubber sheets, or absorbency pads. Thanks for watching. If you liked this video, be sure to subscribe below for more.